Hi, I'm Joe Roth. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and informing people about our life-saving mission. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of One-on-One with Steve Adubato has been provided by Delta Dental of New Jersey. Everyone deserves a healthy smile. The Healthcare Foundation of New Jersey, founded by the Jewish community. NJIT, New Jersey Institute of Technology. The New Jersey Re-Entry Corporation. New Jersey State Nurses Association and the Institute for Nursing. New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation. And by Community Food Bank of New Jersey. Promotional support provided by NJ.com. Small news, big news, true Jersey. And by Meadowlands Regional Chamber, building essential connections that drive business growth.
This is One-on-One. I'm an equal American just like you are.
The jobs of tomorrow are not the jobs of yesterday.
Look at this. You got this?
Here it is, man. Look at that.
Life without dance is boring.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
Do you enjoy talking politics?
No.
People call me because they feel nobody's paying attention.
Our culture, I don't think, has ever been tested the way it's being tested right now.
That's a good question. High five.
We're pleased to welcome Barry Ostrowsky, President and CEO, RWJBarnabas Health. Good to see you, Barry.
Great to be here. Thanks, Steve.
You've talked to us about a whole range of health and related issues on so many of our programs. But on July 27, 2017, a major announcement took place between your organization and Rutgers. Talk about it.
Well, I'll tell you, our partnership with Rutgers, which is that which we announced on the 27th, is perhaps the most transformational initiative we as a system have ever undertaken. And frankly, I think it's transformational for New Jersey. We've long been committed to medical education. We've long believed in medical research, but there really hasn't been a vehicle to take the state's largest healthcare system with the State University, which is an internationally renowned educational facility that does research, put it together, combine the strengths of those two organizations, and in fact have a blueprint by which we can invest in academics and in research, build programs that'll cover New Jersey. So for us, it's terrific. I think it's great for the Rutgers University and for the state of New Jersey.
You know, you and I were talking about impact right before we got on the air here, and you talked about research. Let me talk about it from an applied perspective, translation. The impact, the potential impact on the healthcare landscape in the state, and frankly, more importantly, more specifically, the consumers of healthcare.
That's what this is all about. Of course, our mission is to make the lives of the people in New Jersey better, no matter how we can do that, whether it's addressing social determinants, or whether it's delivering healthcare services, or whether it is, in fact, discovering new healthcare services, new techniques. And so medical research is not simply an academic affair. It is, in fact, an attempt to make healthcare services better, to determine how better to treat people with conditions and illnesses. And of course, what you just suggested, what is that translational process? And so when you put a big delivery system together with a university like Rutgers, you can accelerate the translation of that which you find in a laboratory to the bedside. And it's not inexpensive, it's a commitment, it's an investment, and it's certainly anything but casual. So part of the motivation behind the partnership that we formed is to accelerate this translational research so that it can impact the consumers. Everything we do, candidly, is about the consumer. That is our mission. How do we make your life better, your neighbor's life better, the community in which you live better? And we think this partnership will enable us to, in fact, attain that goal more easily.
You know, put this in a national perspective, if you could, for us, Barry. There are some research-based universities that are actively involved and are branded, dare I use that term, in the healthcare community with other healthcare institutions, and they really stand out. Is this different from that and a New Jersey way, the New Jersey approach to achieving that, or is it totally unique?
Well, I don't know that it's totally unique, but you and I agree that New Jersey has a number of unique characteristics. And the truth is, since we're focused on the people of New Jersey, it has to make sure that it fits comfortably within the New Jersey culture. But I will tell you that the goal here is to make New Jersey a destination for healthcare service, academics, and research. By the time this partnership begins and frankly gains the traction we know it will, people will be looking at New Jersey and talking about this partnership in the same paragraphs as you were to mention any of the other great nameplates throughout the country. In those cases, they've begun these earlier. In this case, we're just beginning it now, but New Jersey is in fact a place that people will come in order to get the kind of healthcare service that they deserve, and they'll be getting it from this partnership of a great university and a great delivery system.
You know, as you know, I'm fascinated by questions of leadership and organizational communication, et cetera, which, and I've, to disclose, I've done a fair amount of coaching around leadership and communication within your system, the system that you lead. But what I'm fascinated by is two very large institutions coming together. Does it look like this? Or is it, I mean, without getting into the weeds on this, it's a challenge.
There's no question about it.
Well, worth it, but a challenge.
It's a challenge, but these are two successful organizations, highly confident in their expertises. And that's important.
Explain that, what that means.
So Rutgers understands that it's a wonderful academic organization, has a great track history in all areas of research, and it's confident that it can continue to perform that well and better through this partnership. We're highly confident in our ability to manage healthcare facilities, physicians, to deliver great clinical care and integrate with our communities. So when two partners get together, each of which is highly confident in what they can do, they have to sit down and decide, if we did it together, would it make it better? And so we spent months figuring out how putting it together would make it better. And it's trite, but 1 + 1 will make 3 in this case. And so, yeah, it's not easy because we're both very much firmly committed to our pre-existing missions. Now there's a new mission, and we've each subscribed to that enthusiastically, I have to tell you. And so there's great enthusiasm around this, but it's going to work because each of us will rely on the skill set that we bring to the partnership. And I think by further developing that skill set, we're going to get great results.
Last question. We are in Newark. And Newark Beth, one of the crown jewels, if you will, of the system, RWJBarnabas Health system. I know well because members of our family, especially my dad, treated there for many, many years. And the heart program, heart transplant program, the 1,000th heart transplant has taken place at the Beth.
Unbelievable. It's an incredible accomplishment. The Beth is a jewel, certainly in any system, and thankfully it's in our system. I was born at the Beth, so I have a particular interest in it. It developed initially the Great Heart Program in New Jersey and began the first heart transplant program in our state. And as you say, did their 1,000th, which they've already exceeded, heart transplant. If you look across the country, there are only 11 hospitals in the history of the United States that have ever exceeded 1,000 heart transplants. And here, one of them is in Newark, New Jersey. The innovation at the Beth has historically been at the top of the list. And so we're so proud of the professionals and the rank and file and the leadership team there for this great milestone. And there'll be more to come.
Barry Ostrowsky is the President and Chief Executive Officer of RWJBarnabas Health. We talked about the Rutgers partnership and collaboration, also the 1,000 heart transplant. Thank you, Barry. Appreciate it.
Thank you, Steve. Appreciate it.
To watch more One-on-One with Steve Adubato, find us online and follow us on social media.
This is Steve Adubato. This is part of our Help for Our Heroes series. We're actually coming to you from the Healthcare Foundation of New Jersey, and we're pleased to be joined by one of the people who cares deeply about our veterans and others who have needs, particularly in the area of healthcare, is Eva Turbiner, who is the President and CEO of Zufall Health Center, which does?
We are a network of community health centers in 6 counties in northern and western New Jersey, and we provide medical, dental, and behavioral health services for anyone who needs it, regardless of ability to pay.
Let's deal with the dental piece of this. One of the things that struck me is there's a mobile van.
We do. We have a mobile van.
Talk about it.
It was funded for us by Delta Dental and also Partners for Health. And that vehicle is a fully licensed two-dental operatory office on wheels. And we take that van to serve populations who need care, and that includes vets. One of the wonderful projects that we have in Morris County is that we take that van several times a month to the community-based outpatient clinic run by the VA, and we provide discounted or oftentimes free dental services for our vets. I think one of the issues that isn't well known is that the VA doesn't cover regular dental care. They only cover dental care for veterans who have service-related disability. And therefore, oftentimes vets go without dental services.
I'm struck by the connection between oral health and overall health.
Yes.
Talk about that.
We take a holistic approach to health services, so we integrate oral health, physical health, and behavioral health all at the same time. We understand that people will come to a health center for a number of different reasons. So they may come in for dental care, and we find out that they have high blood pressure or perhaps diabetes. We can treat that. And while they're in the exam room for medical care, we may find out, we'll do screening for depression, anxiety, PTSD, and we'll find out that they have behavioral health needs as well. And we try to provide all of that as convenient as possible.
One of the subjects we talked about, we had a roundtable of 12 experts, advocates, people like Eva who care deeply about our veterans and servicing them. And one of the issues that kept coming up were some of the challenges of connecting and finding veterans and having them feel comfortable enough to reach out. You know, as part of the series, Help for Our Heroes, we're putting up websites and telephone numbers, and it was like, well, there's no one clearinghouse to do that. How do we get people to call? Firstly, even if you had a clearinghouse, could you get people to call? Am I making too much of that?
Well, I think our philosophy has always been bring services to where people are.
Bring it to where they are.
Bring it to where they are.
And
instead of come to us, we reach out. So we have a large outreach team. We have 2 mobile vehicles. In addition to the dental van, we have a medical van. We bring it to the homeless shelters. We bring it to the community-based outpatient clinics for the vets. We bring it to schools. We bring it to college campuses so that we reach people where they are. We know certainly in many parts of New Jersey, there's not great public transportation.
That's
and
right.
Not everyone has a car. So we will reach out, co-locate services at housing for vets. We will come to whatever campus is needed to provide services and provide safe, non-stigmatized entry into care.
Last question. Do the non-stigmatized thing.
Non-stigmatized. Well, not everyone wants to go into a building that says mental health services.
That's right.
And so if you go into a building and you're just getting your annual wellness, your annual physical visit, maybe your dental services, it provides an environment where you can also perhaps find out about what other services are in that building or what other services are provided by our partners.
Why do you do what you do?
I have a tremendous commitment to the underserved. We know that there are people in New Jersey and certainly across the country that are not well served by our normal private practice or even the VA or other government-sponsored programs. We believe programs are needed at the community level, and I'm committed to doing that. We have 35,000 patients across 6 counties in New Jersey right now, 35,000. And the need hasn't gone away, even with the Affordable Care Act, even with increased support in many ways. We know that there are people still in need.
Eva, thank you for what you do every day.
Thank you very much. Appreciate your concern.
To watch more One-on-One with Steve Adubato, find us online and follow us on social media.
We're speaking with Dr. Lauren Strober with Kessler Foundation, also Research Assistant Professor, Rutgers, New Jersey Medical School. Doctor, describe your research here at the foundation, particularly as it relates to MS.
So I have 2 avenues of research. The primary one looks at employment and outcomes and quality of life. And the second is actually on secondary complications associated with MS. Things such as depression, fatigue, sleep disturbance, personality changes, things that are not commonly thought of in MS, but actually are quite debilitating and pretty common.
Talk about the depression connection.
So depression is much more prevalent. About 50% of MS patients report an incidence of depression during their lifetime. It's much higher compared to the general population as well as other medical conditions. So we know that it's a significant problem. It's both directly related to the illness, but more so related to psychological factors, such as coping and cognitive impairment and social support, perceived lack of social support in particular, all relate to depression and MS.
Let's try to break this down for folks, because I don't know what most people think when they try to imagine or think about someone dealing with MS, or you know someone dealing with MS, or someone watching right now has MS. But try to describe for folks, because you have so much experience dealing with patients with MS, what they are facing and how it could manifest itself in someone who ultimately winds up dealing with depression.
Right. Well, I think the biggest factor about MS, at this point, there's no cure. We don't know exactly what causes it, and it's a variable and very unpredictable disease. So you don't know, perhaps if you'll be disabled and in a wheelchair in 20 years or maybe 5 years. So I think that's the biggest part. It's that sense of locus of control, what we call, or perceived ability to manage an illness and feel like we can exert some behavior change or some control over an illness. MS is not that type of illness. It's not something that we can see a marker and say, oh, it's coming down or it's getting better, and perceive what's going to happen in the future. So I think that depression, a lot of times, is that uncertainty, the perceived uncertainty or lack of control over the illness that you have.
What about for family members? Have you interacted with family members who, they are trying to be there for family members with MS, and you're talking about this loss of control. What about for family members?
Well, certainly they could feel the similar loss of control and uncertainty about their future as well with this partner. It's interesting that we think of caregiver burden much more often with elderly patients. So most of the research to date has been among people who are older, who are dealing with Alzheimer's or dementia and that burden. Only in the, past decade have people really given more attention to sort of the younger counterparts, people with MS who are in their 30s, 40s, getting diagnosed, and maybe they're just starting off their life and making family decisions and work decisions, and that really affects their spouse or their partner. But only recently have we really started paying attention to what that impact has on their life and their perceived future and uncertainty as well. So it's slowly becoming aware. Certainly depression, we know in healthy population as well, if your partner is depressed, has a huge significant impact on you. It can lead to you having greater depression as well. So overall, I would say depression is a global, it's not just a patient, it affects the whole family, their partner, their children, their parents, everybody.
The other area that I want to talk about, and you did a study involving 107 employed individuals with MS, right? Tell us about that, because then I want to ask you a little bit about sleep-related issues. Talk about the study itself.
So that was actually a really neat study. It's a follow-up study that I did probably nearly a decade ago. So we know that fatigue is a debilitating problem in MS. It's probably the most frequent problem and the most detrimental to one's being that we know of. Up to 97% of patients will complain of fatigue at any time. To date, we always looked at things such as the disease itself causing fatigue, as well as depression actually being a leading cause. Intuitively, one would think, well, what about sleep? Because I would think if I have sleepiness, right, or fatigue during the day, it may be very well attributed to how well I'm sleeping. No one's really looked at it. It started in the early 90s, people paid attention to it, and then it kind of drifted off. So we did this study about a decade ago. We showed that actually sleep disturbance was the #1 predictor of fatigue in MS. And we replicated that in 10 years later, similar findings in a larger sample, same exact thing. Disease does contribute, depression a little bit, but the #1 factor that said why somebody might be experiencing fatigue was sleep disturbance. And that could be attributed to many things such as depression and worrying, but also to the physical symptoms of MS. So there's sort of this trifecta of symptoms. So getting up to use the bathroom, bladder incontinence, or muscle stiffness, leg spasms. Those all contribute to somebody getting up and having poor sleep, that while it's directly related to the illness, it indirectly, through their sleep disturbance, causes them to have greater fatigue.
Let me ask you this, Doctor. In light of, or in spite of, everything you just laid out, the challenges, the difficulties, these so-called secondary complications for patients with MS. Are there, in fact, reasons to be hopeful and optimistic as it relates to the MS research right now?
Oh, I would hope so, for sure. There's great hope, and I think is more important than our research, and we do research every day, that I think leads to great hope. But I would say the more important thing is for our patients to have hope. And in fact, things such as resilience and extroversion and coping skills and having a sense that some people even find meaning due to their MS or find purpose in life. They find it part of their narrative. It's part of a chapter that's going to go through their life, but it doesn't define them. But they lead it to kind of sense that life is still more meaningful because you question things a little bit more, I think, too. So I think that our patients have a lot of hope, and I hope that we do enough research that can bring them hope to know that we are doing more, but that they're in their daily lives, that they are optimistic about MS and their own lives.
Thank you, Doctor.
Thank you.
Hi, Steve Adubato here at Kessler Foundation. There's a very compelling and important forum on MS research that I'm going to be honored to moderate. And one of the participants I'm thrilled to be talking to right now, she is Meg Balter. She's an MS research participant at the foundation and a registered nurse by profession. But a little less than 40 years ago, you were diagnosed with MS, correct?
Yes, 40 years ago.
Talk about what you experienced and what made you first think that something was happening and your reaction.
Okay, I was a nurse in a med-surg unit at the hospital, and I was walking downstairs, and one foot was not going in front of the other anymore. I'm like, it should be something you just run down the stairs and not think about. But I had to think about walking down the stairs. And then I was playing tennis with my future husband, and my left leg went numb. And I started thinking that it was something that I did with my back, moving patients, and I went to see an orthopedist. And he said, no, you need to go see a neurologist, and that's when I was diagnosed. But 40 years ago, being diagnosed was a little bit more difficult than it is today. It was a little bit more medieval.
So let me ask you this, because we've been talking to a lot of folks about how it's impacted their lives. And so you had this career as a nurse. Did you continue working?
I did, for as long as I could, but my legs pretty much gave out on me. I was on crutches, sleeping in leg splints. The more I worked, the harder I tried, the weaker I got. So my husband and I did some research, and I backed off, and I did rest, exercise, and diet. And those three things helped me get more equalized, and I stayed with that. And I did some private duty nursing. I tried to stay in it, but then I was signing my name backwards a little bit, and numbers were getting mixed up. So given meds, that's not such a good idea. So that was that.
Meg, when did you decide that you were going to participate in research?
Okay, we were living in Essex County, and my youngest was about 8 years old. And I was interested in research, and I was looking for something to do with my nursing background. So I found Kessler, and I started doing that 17 years ago, and came up through the ranks. I've done many studies with them, and I've learned so much from them. So
talk about that.
It's me.
Sorry for interrupting. For a lot of people, I imagine, a lot of people watching right now, they might say, well, I've heard of these studies, but I don't really know what it means to participate in a study. Describe for folks what it really means.
Okay, yeah, I even asked my brother, why wouldn't you participate? He has MS also. He goes, well, I wouldn't do that. I'm afraid. What do I need to do? It's nothing. You just come be yourself, and they're so great. They're so warm and friendly. They make you feel like you're in your own living room, but they're testing you without you even knowing. They're looking for things, but something that you can just give them. There's nothing you can think about. You just do it.
But it's more than that in this sense. When I was reading about you, you have said to folks that being a participant in these studies has made you also feel like you are giving back and being a part of the medical and health profession.
Yes.
And that's true, you are.
Yeah, that's important to me. I want to be productive. And 40 years ago, my nursing was gone. So my profession was gone. And we did have 3 children, which is wonderful, but then I wanted to do more. I wanted to be involved in the research and be part of it.
But the other thing that's fascinating to me about you is you obviously have this incredibly positive attitude. You continue to live a really productive life and the best way you can. But that positive attitude, where does that come from, and how have you maintained it?
A deep faith in God. Surrounded by a wonderful family. My husband is a pharmacist. He's the most supporting man. I mean, he knew me when we were dating, and he went through this whole mess with me. And my family. I have 6 brothers and sisters and my 3 sons. They're wonderful, And they've always been supportive, even when they were little and they didn't understand when I had to go rest. They just let me do it, and then I got up and went back to doing what I was doing. So everybody's been very supportive of me, and that makes me happy, and it's all good.
And finally, your life today, in spite of, I know you said, quote unquote, it's all good, but some of the challenges you face today would be?
The big is fatigue and struggling with cognitive, getting in conversations with people and losing your train of thought. You can be very intelligent and have a conversation with somebody, and then you come off as being like the big dummy because you can't get your words out. So that's frustrating. There's a lot of frustrating parts of MS. You wish that they could come up with a cure, but I think what Kessler is doing as far as making our lives a little bit better is wonderful.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Delta Dental of New Jersey, the Healthcare Foundation of New Jersey, NJIT, the New Jersey Re-Entry Corporation, New Jersey State Nurses Association and the Institute for Nursing, New Jersey Sharing Network, and by Community Food Bank of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.
I think at NJIT there are a lot of smart students.
I came to NJIT for mechanical engineering because with in-state, it's one of probably the top 3 schools for engineering.
It sort of creates a friendly competition where you can learn from them.
It's a great academic school.
I feel I'm being challenged, but at the same time, I love the classes I'm taking.
The atmosphere of being here is like being at an upstart company. It's that same kind of drive, that same kind of passion.